And this message was that if she wasn't careful, she'd be wearing her ribs on her pelvis, meaning that her spine was so fragile that any sort of slip off a curb and wrong step would lead to, for her, visually seeing her ribs on her pelvis. Now, I can't imagine what it must be like to repeat that mantra in your head for years and years and years. So we can kind of see where this would perpetuate huge behavior changes. So what were intended as short-term movement precautions and perhaps a cheeky remark by a previous provider, this really became her identity for this patient. So she lived in this constant storm of hypervigilance, anticipatory anxiety, rumination, and a suffocating sense of fragility and withdrawal. Withdrawal not just from her family and activity, but also from who she was as an identity, as an individual, So in our sessions, how did we begin to help her step away out of the storm? And I say we as we lean into this next portion of the presentation, because it was super important to establish a team sort of effort here to make sure that she knows that she had a guiding hand alongside with her so that we could then help propel her into more self-agency and independence. So resolving the conflict, or some of the interventions we did beyond some of the typical physical therapy things we're all aware of. So first we can go back to those conflict resolution tools that I talked